Hello, everyone. This is Chadi Alraies from RSH 2025, third edition. I'm really privileged to be with Dr. Purvi Parwani to talk about gender and sex discrepancies in structural heart. Purvi, always nice to see you. And nice to see you in Riyadh.
Yeah, no, it's been amazing. My
Yeah.
first time in Riyadh, Saudi Arabia.
Hmm.
So, Shadi, you know that I'm the Ecolab director at Loma Linda,
Yeah.
and I think one of the things on this in this conference, what we focused about was we had a session all led by women panel, and we spoke about the sex differences in structural heart disease. And I think this is very evident in my day to day practice in the Eco Lab because we know that men and women, both our anatomies and physiologies are different. We know that aortic stenosis treatment has been now, a routine transcatheter treatment we are routinely offering to our patients, but there are some discrepancies when it comes to diagnosis of aortic stenosis as
Right.
well as treatment. Women are referred less for TAVR.
Yes.
They have slower progression of aortic stenosis.
Hmm.
And why we think that is because men and women, again, have a different physiology of the heart. So
Yeah.
typically, if we look at a woman patient, they have smaller aortic annuli.
Hmm.
When they get aortic stenosis, they get more hypertrophy.
Hmm.
There is more concentric hypertrophy, and what we tend to see more is the paradoxical normal flow, low gradient aortic stenosis, which I think, to be honest with you, one of the points that I made in this session is that whenever we see things that we cannot understand, I think as physicians we get like a diagnostic fatigue, and people like to put things in the boxes.
Yeah.
So I personally think that there is a lot more aortic stenosis that is severe, that dwells into that category. But because we don't understand how to categorize the patients, we put them in a bucket.
Yeah.
As you also know, there are differences with which valve to use, etc. So I think it was a fascinating session where we focused on these differences, spoke about different trials that have focused on women.
Yeah.
And I personally learned a lot and enjoyed it a lot.
Yeah. So, Purvi, also in terms of any specific changes or from imaging standpoint or from clinical, somebody who's have a patient in the exam room, we should be vigilant for in women that we saw, you know what, for that particular patient she should be referred for a valve replacement regardless what therapy it is, because they present differently.
Yeah. I do think that with all the advances that we see in multimodality imaging, we have so many tools at our disposal. And I don't think that if you look at the community cardiology level, I don't think that we are utilizing it.
Hmm.
So, one of the things that I always tell everyone that, whenever there is, in cardiology, we see a lot of mixed disease, particularly as the age advances. So people may have mixed cardiomyopathy, they may have aortic stenosis, but they may also have amyloidosis, right? Women tend to get more fibrotic changes in the aortic wall compared to men who get more calcification. So using the cardiac MRI, cardiac CT to look at the aortic calcification and the score, the calcium score of the aortic valve, utilizing 3D echocardiography with our mitral valve, the tricuspid valve, etc. I think would be the way to go. So I think regardless of the gender, of course, multimodality imaging applies more to women. And why I say that is because think about it, the volumes, the size of the LV, RV,
Different.
everything is different in
Right.
two genders. And we don't accurately predict it on echocardiography.
Absolutely.
Most of the centers in United States still are, or anywhere in the world, we are still stuck on 2D echocardiography.
Right. You're seeing an image in front of you and you look at it and you just put the
Exactly,
metric together and
exactly. And
push it.
whoever says that, we don't, oh, this is too advanced, too expensive, the CT on CMR, actually, that's not true because every hospital anywhere in the world now has an MRI machine and has a CT machine.
Absolutely.
So it's all about making those resources work where you put a cardiac package, because you know what? Cardiac patients are everywhere in the world.
Right.
And making it work. And the good thing is, our societies are doing such incredible work to bring that education to various parts of the world. One thing that was very fascinating to see here is how many women cardiologists are here in this region,
Yeah.
and they're doing incredibly well in
Nice.
the field of structural
That's true.
heart disease. So no, I think there are a lot of opportunities that lie ahead of us, and just cannot wait to see what future brings us.
Thank you so much, Purvi, for your time and for a great session, and also for your contribution to the conference.
Of course, thank
Yeah.
you for inviting
Yeah,
me.
watch these videos and others on YouTube channel and the website. This is Chadi Alraies coming to you from Riyadh Structural Intervention and Heart Intervention in 2025. Thank you.